Water-related emergencies. We can have people that have airway obstructions. They can go into cardiac arrest, internal injuries, head and neck from diving into unknown waters, drownings. So any kind of injury or medical condition that can be found in the water, so make sure you do a thorough assessment. You may have someone who's intoxicated or under the influence of drugs, falls into the water, something like that. Someone's running around the pool even though they're not supposed to. They slip and fall into the water after they struck their head. What is drowning? Death associated with an immersion in water within 24 hours. Now, immersion is your body goes completely underwater. A submersion would be where you have a child that drowns in 3 inches of water in the bathtub. The child's left unattended. The child falls face down into the tub and just their face is underwater. Primary concerns are, everyone's safety is by far. If you go out to a lake and you don't know how to swim, then you don't need to be the one going in and trying to retrieve that patient. Make sure, especially if there's a history that, they dove into the shallow end of the pool, but if there's no history, they have no idea how the guy got in the pool. If you're in shallow water, always consider C-spine precautions whenever you're dealing with these people. If a cervical injury cannot be ruled out, if they need to be resuscitated, then you can certainly resuscitate them and you can collar them, but I hope you know that you don't do CPR in the water. Even if they're on a backboard in the water, you don't do CPR until you get out on solid land. If the patient's responsive and the spine injury has not been ruled out, then you need to make sure you immobilize the head and use the backboard to remove them from the water. If the patient's found face down, extend their arms straight up, and then you can rotate the torso towards you as you lower yourself into the water. Now you can maintain stabilization of the head between the patient's arms, and then you can slowly take them over again to solid land. So if the patient does not have a spinal injury, then turn them on their left side. If there's any obstructions, you can either manually or by suction remove them. You may have to do abdominal thrusts if there's a foreign body, and oxygen to keep the patient warm. All right, so with diving accidents, the stuff that you put in your bottle is air. It's not oxygen. It's 78% nitrogen and 21% oxygen. So when you are diving, excuse me, for every 33 feet that you go down below the surface of the water, you're entering into a different atmosphere. So when you're 33 feet or up to the surface, your lung capacity is at 100%, as if you were not even in the water. But as you get to that 33 feet to 66 feet, your lung capacity decreases by 1/2. All right, so you don't have the breathing capacity that you did when you were at the surface. Injuries on the bottom, you can get a condition called nitrogen narcosis, and what happens is the nitrogen that is in the bottle that you're breathing in starts to get released, and it will start to collect in your joints. You're going to have joint pain. It may even feel like you're having a stroke, like you're having paralysis on one side. Like when you pop your joints, that's what you're hearing when you hear that popping noise, is the nitrogen being released. Now, when you ascend, you're not supposed to ascend more than 1 foot per second, and that may be hard for you to determine, so you're not supposed to outswim your bubbles. So they can get a condition called decompression illness or decompression sickness. Their ears may may start to rupture. Their nasal passages may start to rupture. So they also may throw a air embolism, and if they have an air embolism, it can travel to the heart. Then it can be pumped out to the lungs and cause a pulmonary embolism, or it can be pumped out to the brain, cause a stroke. And again, it's going to be very difficult, I would think, for you to surface with only one side of your body working. So what do we do for these folks? Get them out of the water. You put them on their left side with their head down. So basically Trendelenburg, but they're on their left side. The reason being, if they do have an air embolism, that's going to make it more difficult for the air embolism to enter into the heart, because we all know air rises. So if you can get that air embolism to kind of hang out in the right side of their body where it can't be picked up and taken back to the heart, then that's what your goal is by putting them in this position. Take them to a recompression chamber or a hyperbaric chamber. I believe there's only 2 hospitals in Dallas that actually have a hyperbaric chamber. If you do have to rescue someone from the water, just remember the 4 words: reach, throw, row, and go. Reach for them first. If they can't grab you, then throw something to them that they can grab a hold of. If not, then you have to row out to them and then get them. So, okay, bites and stings. Try to find out, what kind of critter bit them. Was it a spider? Was it a snake? Was it a marine animal? With all these, there's most likely going to be some pain, some redness, some swelling in the area. Rapid pulses, blotchy skin. You see all the signs and symptoms that you may see here. So, treat for shock. Wash the area gently with soap and water. Mobilize the affected limb at the level of the heart. So, most people that are going to get stung or bitten will be on an extremity. So if you just lay them supine with their hands by their side, that's perfectly fine. Don't let them exert themselves. Any jewelry that's there, remove that. And then some people, the sting is bad enough, but they may have an allergic reaction on top of that. So make sure that you watch out for that as well. So if the stinger is still present, we talked the other day about taking your credit card and removing it. Please do not use tweezers, because the venom sac is probably still attached to the stinger. All right, so with snakes, we have pit vipers in Texas. We have rattlesnakes, we have copperheads, and we have water moccasins that are the pit vipers. Coral snakes are not pit vipers. However, they are still poisonous. So usually you can tell a pit viper is a pit viper because their head is diamond shaped. Their neck behind their head is going to be smaller than the head itself, whereas your non-pit vipers are not that way. If you're close enough to see their eyes, you're going to see elliptical pupils. If you're even closer, and you will see 2 very large fangs on these snakes as well. The coral snakes down here, they have small rows of teeth, so they don't really have a triangular head here, or diamond-shaped head. There's an old saying, red on black, venom lack. Here you see red on yellow, kill a fellow. So there are some snakes that would look like a coral snake, but if it's red on black, meaning that the red is next to the black stripes, then they are non-poisonous. All right, so you can clean with soap and water. Forget about this. We don't apply constricting bands anymore. I'll try to change this after today. I'm sorry I didn't beforehand. We don't apply constricting bands on anymore. We just keep the extremity at the level of the heart, and then we transport to the hospital. It's a good idea to call ahead to the hospital to see if they have the antivenom at that hospital. If they don't, then you may need to divert to another hospital. We don't do what we used to do in the past. We don't cut and suck anymore. We used to do that. We used to even have kits on the ambulance that had a scalpel and a suction cup in there with it, but we don't do that anymore. Don't put cold on it anymore. We don't use electrical therapy on it anymore. So just keep them stable, not moving in a supine position, and transport to the hospital. Okie dokie. So this takes care of submersion injuries, snake bites, and spider bites. Let me go one more thing. I didn't have any slides on this, but the two biggest spiders you need to be worried about around here are your black widows and your brown recluse. The black widows obviously are black, and if you were to pick one up and look at its belly, there's going to be a red hourglass on the belly. These inject what's called a neurotoxin into your blood, and when they bite you, so they're going to have muscle rigidity, most notably in their thighs and in their abdomen. If you ever see a test question that's talking about a bite, and you see something in there on a sign that says they have a board-like abdomen or a rigid abdomen, then you're looking for a black widow. Again, not much you can do for a black widow other than wash it with soap and water and transport to the hospital. With the brown recluse, obviously they're brown and they have a fiddle or a violin on their back. These cause skin necrosis when they bite you. If you're bitten by a black widow, you're probably going to know you got bit by a black widow. However, with a brown recluse, you could be bit and not know that you have been bitten. So this causes your skin to necrose or die. And so it will start out very small as just a little bleb, and then it will start to expand after that. So again, get them to the hospital, both of them actually, to the hospital, and let them take care of these bites. So for now, goodbye. Have a good rest of your day.